Hello friends, today we'll learn how to manage a curved canal. Curved canals can be a very difficult problem to an endodontist and a general dentist because they pose a very difficult challenge to all of us. So there are few basic steps that we should all know in managing a curved canal. I'll be discussing a step-by-step approach. So basically there are 8 steps which are involved. First is the access cavity preparation. So you should always have a straight line access to the canal. Once you have a straight line access, the bending of the files is avoided. So any kind of instrument fracture will be avoided. Secondly is use of flexible files. Small number flexible files, 8 to 10 number, that they should be used initially, and they should be night-eye files because they are flexible files. Stiff stainless steel files in such cases should be avoided. Third is the manner of use. We should always go from crown down, that is from coronal to apical. That should be the method in which we should prepare the canal. So here the coronal flaring is to be done first. I prefer not to use Gates Glidden drill for this purpose, but orifice shapers, so that most of the tooth structure is not destroyed. Also, coronal flaring helps in changing this C-shaped curve into a J-shaped curve. Okay, so this J is very easy to negotiate, whereas a C is a double curvature which will be difficult to negotiate later. So always go in for coronal flaring. That will remove any kind of dentinal obstructions and make your path smooth for the files to enter. Then we come to the anti-curvature filing. This is the method of use of the files. In this, what we have to do is, this file, they have flutes all over. Okay, so the flutes in the apical third of the file, the outer surface here, this is the outer surface of the file, the apical third. These flutes should be dulled, and they will be dulled with the help of a diamond file. So a diamond file will make these flutes here blunt. So this is the apical third and this is the outer portion. So these will be dulled here. Then in the middle third, this is the middle third. So the inner portion of the middle third, again the diamond flutes will be dulled with the help of a diamond file. So the file flutes have to be made blunt, and this will be done with the help of a diamond file. So this anti-curvature filing is an important filing technique which is to be followed in a curved canal. First, apical third, the outer surface has to be made blunt, the flutes, and in the middle third, the inner surface have to be made blunt. Then we come to patency and recapitulation. Patency is nothing but 8 or 10 number files, K files, should be taken till the working length again and again. And recapitulation is with the smaller size files, we have to recapitulate. So this is done in order to avoid any kind of canal blockages. Glide path, always prepare a glide path with the small files before using rotary files. So rotary files, they'll aid in managing your curved canals properly, in retaining the shape. But first you have to make a glide path with 8 or 10 number K files and then go on to the bigger rotary files. Lastly, but very important, is to maintain irrigation. So 5% sodium hypochlorite and EDTA, they should be used again and again. Copious amount should be used of sodium hypochlorite in order to avoid any kind of canal blockages. So if you follow all these steps, you will be able to manage a curved canal properly. Thank you.